Hello, how are you doing? This is Dr. Ahmed Kamara of Doctor to You. This information there to help you to take control of your health and ultimately be a master of your own health, to be able to help yourself and help your clinician, your doctor, your GP, your nurse practitioner look after you better. What I want to talk to you about today is lactose intolerance. This is something that I get asked about a lot in clinic. You know, the symptoms include abdominal cramps, abdominal bloating, excessive wind such as burping or actually passing flatus or farting, dare I use that word. Some people may also have loose stools and genuine, abdominal pain as well. When the symptoms arise and persist, it makes patients wonder, whether they may have lactose intolerance. Perhaps they've done an internet search and that's one of the things that has come up. So what is lactose intolerance? A lactose intolerance is an intolerance to lactose. Lactose is a sugar, a disaccharide that's present in milk predominantly. It's made up of two smaller components of sugar called fructose and galactose. So when you drink milk, which contains lactose, the lactase in your body, the enzyme, the chemical, breaks down the lactose into fructose and galactose, which are smaller sugars. These sugars are better absorbed in your intestine, into your bloodstream, your circulation. Now, if you have lactose intolerance, there's a deficiency of this enzyme, this chemical called lactase, which means that your body cannot break down the lactose really or as efficiently as it should. The lactose is then digested by enzymes in your large intestine, and this produces a lot of chemicals that cause the symptoms that are associated with lactose intolerance that I mentioned earlier. So let me just recap on those. That's abdominal bloating, cramping, excessive wind that makes you burp or pass wind, flatus, or abdominal discomfort, or sometimes loose stool. Now, what can you do if you suspect you've got lactose intolerance? So the simple thing to do, first of all, is to eliminate milk, cow's milk from your diet, perhaps for 2 to 4 weeks, and then see if that really helps your symptoms. It's also helpful to do a food diary for at least 1 to 2 weeks. Really chat what you eat and then chat your symptoms against those. That may also be able to help you detect what may be contributing to your symptoms. Now, if you do suspect it, it's worth, and you've done those things and it hasn't really helped, you've eliminated it, hasn't helped, it's important that you see your GP. And let's talk about what your doctor might do. And we'll go through the symptoms, and our aim would be to not only diagnose what's going on, but also rule out other potential causes of similar symptoms. For example, celiac disease, that's gluten intolerance, can cause overlapping symptoms, and we may do a test to exclude that, or we may ask you to eliminate gluten from your diet for a period of 2 to 4 weeks. There are other causes as well, such as inflammatory bowel disease, or irritable bowel syndrome, or other causes of abdominal discomfort, which will arrive at from asking you pertinent questions, examining you, and maybe doing some blood tests or scans. Now, specifically with regards to lactose intolerance, the elimination of cow's milk from your diet may be sufficient, okay? But if that's not sufficient, then there are specific tests that can be done in secondary care, and we may refer you onwards to have these done. One of these includes doing a hydrogen breath test. So you remember I mentioned earlier that when you lack lactase enzyme, it doesn't digest, it doesn't break down the lactose efficiently. As a result, a lot of chemicals, hydrogen in particular, is produced when the bacteria in your large bowel digest the lactose. So a hydrogen breath test is something that can be done to detect that. Another test that can also be done is you may be given some milk to drink, so up to 500 mils, and the idea is they'll check your sugar level at baseline and periodically over a couple of hours check your sugar level, your glucose level, to see if it rises. Now, if it doesn't rise at all, that means you may well have lactose intolerance, because the sugar will rise if the lactose gets broken down into fructose and galactose, which are sugar units that can be measured in the blood. So that's another way of doing it. Now, other tests might be to exclude other causes of similar symptoms that I mentioned earlier, celiac disease as being one of those causes. So assuming you've been diagnosed with lactose intolerance, it's important to know what simple measures you can take to help yourself. And remember, I always advocate doing what you can to be in control of your health as much as possible, alongside what your clinician will advise. Avoiding cow's milk would probably be the initial thing, but if you do want to have cow's milk, then you can have lactose-free cow's milk. There are other forms of milk that do not contain lactose, and that includes soya milk, almond milk, coconut milk, hazelnut milk, rice milk, oat milk, etc., etc. There are several examples you can look for in the supermarket. It is also important to note that cow's milk is very helpful with the absorption of vitamin D and calcium and other essential vitamins. So if you're not having these, you may then become deficient in these important vitamins or minerals. And if that is the case, it's important that you speak to your clinician or a dietitian to get specific advice about what supplements you can take to help you. I hope you found that useful. This is a quick whistle-stop tour on lactose intolerance. I look forward to seeing you again on our next short video on another key medical topic. Until then, look after yourself and be a master of your own health.